Hello there, this is Dr. Brown Hilda Santo. Today we get another important topic for talk about. We're going to talk about the heart. Say if your heart is sick, it means say you too is sick. So what will be the topic for today? We want to talk about the signs and symptoms the way when you get them, you no get for ignore them, because if you just be in a signal say you did get a heart attack or you go get a heart attack. Most start by defining what it will be cardiovascular disease. So it is so cardiovascular disease when a disease of the heart and blood vessels them, now the leading cause of death worldwide. In fact, with 7.9 million people the way that they die every year from cardiovascular disease. So what it be even a heart attack? What did it happen where it cause you forget a heart attack? A heart attack they happen now when you get decreased blood supply or interruption of blood supply to the heart muscles. In fact, we will see some short video where it will show you how this is happening. But what did it happen? I say you get buildup of what they call and say plaque, where this plaque be made up of fat, cholesterol, and some other substances. Then it build up for the walls of the vessels, and as it build up, before you realize it only short the vessel. And as it make that vessel the narrow, now so blood supply to the heart muscles then they be interrupted. And at some point even that plaque fee build up so it just block that blood vessel and you don't get any more blood supply downstream. And when you don't get blood supply, then that cells and for that heart muscles will start die. Sometimes it is so that plaque there so it go rupture, it go break off, and then it now travel, it go now for some other smaller blood vessels then. And when you go for some smaller blood vessels the way they get smaller diameter, it go just go block them, and then now all that cells and where they did behind that muscle, it go just die. It is so although na the most common way this way if you get heart attack, sometimes they way some people they fit take medication or substances then way if it cause spasm. So anything where it go make that blood vessel narrow or it shut down or it constrict, and it as a result decrease blood supply to the heart muscles if it cause a heart attack. So if you take cocaine or amphetamines or any of other stimulants them, if it actually cause you forget a heart attack because it will get decreased blood supply to the muscles of the heart. Now we'll see a short video of how this plaque it be built up and how if it lead to a heart attack.
In order for the heart muscles to work well, you get to get good oxygen-rich blood supply. So when the blood vessels start get build up of cholesterol and fat, it cause what they call and say plaques. And these plaques, so if you rupture, it will be exposed, and then other blood components then like platelets they will come accumulate for form blood clot, and this blood clot now it will obstruct blood supply to the heart muscles, and as a result the heart muscles they go start for die, and this go cause what they call and say a heart attack.
So now we don't watch this short video, more talk about what it be the signs and symptoms and way it go alert you say it is so you feel to get a heart attack. Number one, chest pain. It is so this chest pain feel manifest as tightness for your chest, squeezing chest pain, crushing chest pain. Sometimes if you go feel like say now some elephant don't shit on top of your chest so group, you go just feel like so you know if you even even move. That chest is just the heavy, just like some heavy thing don't just shit on top of your chest. This so sometimes it go just remain for middle of your chest. Sometimes this so it go move for this left arm. Sometimes it go move for this right side. Sometimes it go up your neck, your jaw. Some people they will feel them for their teeth. Sometimes it go even feel them where they go for your back. It is so when you start getting this kind of chest pain, especially where the chest pain it just come on frequently, or even when you just don't do anything. It is so the chest pain where it causes heart attack, they call and say angina. Bookman they call and say angina. When you don't get this angina, And especially in the beginning, if it be say when you dey work farm, you dey do something, you dey waka go upstairs, you dey go up some hill, you dey start feel that chest pain, the way I don describe am. But sometimes the way you just shit you so, you no even dey do anything, you dey start dey feel am. When you start dey feel am, that angina don become now wetin dey call am say unstable angina. In fact, wetin wey don dey happen na say that blood vessel don dey narrow, that plaque don probably build up so tey e can't even completely shut down the supply. Na the time that you dey feel that pain, or sometimes the plaque don even rupture, don even break off, and then e go so tey e just go block the vessel completely for some area. When you don get pain wey don dey be na this kind of way more frequently, or e dey happen when you just dey at rest, go see your doctor, because you fit dey get a big heart attack. Wetin be the number 2 symptom wey you fit get am? Shortness of breath. E dey so you wan do small thing, you just feel like say you no fit breathe, you just dey run out of breath, when normally before you be dey do that same activities dem, but you no be dey get shortness of breath. So if you don be na one way you wan do some small things, so you dey get shortness of breath, especially if you dey get chest pain also, go see your doctor. If e be say na heart attack wey you dey get am. Wetin be the number 3 symptom? Lightheadedness. You fit start dey feel like say you dey feel woozy, or even you dey feel like say place just dey spin, especially if na sudden dizziness. Sometimes that you just feel your skin just weak some way, so when you just be lightheaded. If you dey get that symptom, especially if you dey get this other one that I already mentioned am, no ignore am. Wetin be number 4 symptom? Some people dey get a heartburn. You fit dey feel like say nausea, like say you wan vomit. In fact, not na everybody dey get that chest pain the way I mentioned am before. Some people in the way na just the heartburn dey get am. Especially people that dey be at risk, una pay attention very very well. People that dey be at risk for getting a just heartburn, woman dem, people that dey get diabetes, and older people dem. Sometimes any people they need to get that typical chest pain the way I don't mention am. They instead get na heartburn, that they feel like say they get some like reflux, acid reflux. They just feel like say they feel good. Like they want even sometimes nausea, like say they want even vomit. If you get these symptoms, especially with the other symptoms that I don't mention, make sure say you go see your doctor. No take am lightly. Wetin be number 5 symptom wey you fit get am? You feel the sweat. Wetin wey they call am say cold sweat. Place na dey hot o, you just dey break out in sweat. You dey sweat, your forehead dey sweat. You just dey feel uneasy, especially if you get all these other symptoms that I don't mention am. No ignore am. You fit dey get a heart attack. Now, if you get aspirin for house, take the aspirin, start chew am. If you be a person where maybe doctor be don give you some medication, they call and say nitroglycerin, because say you already get heart problems, take that nitroglycerin, put am under your tongue, and then you go for hospital. Some certain risk factors in their way, if it increase your chances for get heart attack. The 3 most common risk factors are wetin? High blood pressure, high lipid level, tobacco abuse. Wetin be the other risk factors then? Diabetes, family history. The men them for that family, if they get a heart attack when they be younger than 55 years old, or the women then when they be less than 65 years old, then that one will put you also at risk for a heart attack. Age. So if for man pikin the way they be older than 45 years old, and for woman the way they be older than 55 years old, they be at risk for get a heart attack. Obesity. If you big, you be at risk. If you use drugs, remember say we don't talk about some stimulants them. Example, cocaine or amphetamine, or anything where if it cause constriction or narrowing for that blood vessel where they supply blood to the heart, if it cause a heart attack. What it be some of the things and where if you do for either prevent you from getting a heart attack or decrease your chances of getting a heart attack? Number 1, lifestyle changes. So you get for try for eat healthy and also for be active. Number two, stress reduction. It is so they overlive a stressful life nowadays. You get for try for do things and way it be relaxing. You know, if you just you only walk. You know, they think about self-care, self-love. So you get for take time out for yourself, for make sure say you take care of your mental health and your physical health. Number three, if you get any of these risk factors that we don't mention them, diabetes, high blood pressure, high cholesterol level, make sure so you take your medications in. Number four, if you smoke cigarette or you use drug, stop them. No benefit, no day from them. Nothing good they come out of tobacco, nicotine, or any of these substances. Then nothing good they come out of these substances. Then, so if you do any of those, then please stop them. I hope say we don't get something out of this presentation today. Una subscribe, comment, and share. Share with una family and friends them. Share with una ex-student association them, una WhatsApp group them, or other social media group them. By sharing, if you actually save somebody's life. Remember, knowledge is power, and health is wealth. Thank you very much, Dr. Brownhilda Santo.